The smell of disinfectant mixed with animal fur filled the small clinic as Amy Walsh bandaged the leg of a nervous Druvian pack beast. The creature had 6 legs and looked like a cross between a wolf and a lizard, but it whimpered just like any scared dog when she touched the injured limb. Amy spoke softly while she worked, her hands steady and gentle. She had learned long ago that fear made everything worse, whether the patient had 2 legs or 6. The Druvian owner, a trader named Gulnik, watched nervously as Amy finished wrapping the bandage. His translator device clicked and hummed before producing words in English. "You are certain he will heal?" Amy smiled and patted the beast's scaly head. "Keep him off the leg for 3 days. Change the bandage daily. He'll be fine." She handed Gulnik a small container of antibacterial cream. "Apply this twice a day." Gulnik paid her in credit chips and led his limping animal out of the clinic. Amy washed her hands and started cleaning up. Her clinic sat in the lower commercial district of Crossroads Station, a massive space hub where dozens of alien species came to trade, refuel, and resupply. Most doctors on the station treated sapient beings. Amy treated their pets, their work animals, and their cargo beasts. It was not glamorous work, but she loved it. She was wiping down the examination table when the door burst open with such force that it slammed against the wall. Amy spun around, her hand instinctively reaching for the tranquilizer gun she kept for dangerous animals. But the being rushing through the door was not dangerous. He was desperate. The Quillen merchant named Breath moved on 4 powerful legs, his upper body humanoid but covered in smooth blue-gray skin that seemed to shimmer under the clinic lights. In his forearms he carried something small and limp. Amy could see phosphorescent blue fluid dripping onto her floor. "Please," Breath said in perfect English, his voice breaking. "Please help him. They said he would die. They refused. Please." Amy moved forward without hesitation. "Put him on the table carefully." Breath laid his burden down with trembling arms. Amy saw a young Quillen, perhaps equivalent to a human 8-year-old. The child was unconscious, his breathing shallow and rapid. Large wounds crossed his torso and the blue blood was seeping from damaged membranes on his neck. Those would be respiratory organs, Amy realized. Like gills, but for processing the oxygen-nitrogen mix that Quillens breathed. "What happened?" Amy asked, already pulling on sterile gloves and grabbing her medical scanner. "Docking accident," Breath said. "Cargo container fell, crushed him against the wall. I took him to Dr. Orthan, the Quillen medical facility. They scanned him and said his survival probability was only 12%. They said they would not waste resources on such low odds. They sent us away." Amy's jaw tightened, but she kept her voice calm. "How long ago?" 20 minutes. 20 minutes of bleeding. 20 minutes without treatment." Amy pointed to a cabinet. "Open that. Hand me the blue packets." "All of them." While Breath fumbled with the cabinet, Amy examined the wounds more closely. The scanner showed internal damage, bleeding from multiple points. The child had 3 hearts, she noted. One was beating erratically. The respiratory membranes on his neck were torn, not functioning properly. Without them working, the child could not absorb enough oxygen. This was beyond her training. She was a veterinarian, not a xenobiologist. She had never treated a Quillen. She had barely seen one up close before today. Everything about this was wrong and dangerous and probably illegal. But the child was dying. Amy grabbed an oxygen mask and modified it quickly, holding it over the damaged neck membranes. The child's breathing eased slightly. "Talk to me," she said to Breath. "Does he have any allergies? Any medical conditions?" "No. Nothing. He is healthy. Was healthy." Breath's voice shook. "Can you help him?" Amy did not answer immediately. She opened the blue packets, which contained synthetic sealant, and began carefully applying them to the worst wounds. The bleeding slowed. She grabbed her datapad with bloody gloves and pulled up the station's medical database. She typed quickly, "Quillen physiology." The information flooded her screen. Copper-based blood. 3 hearts arranged in a triangular pattern. Decentralized nervous system. Respiratory membranes that functioned through osmosis. She scanned through the data, her mind racing. This was similar to Earth cephalopods, Octopi had copper-based blood too, 3 hearts, distributed nervous system. I need you to listen carefully, Amy said to Breath. I am not trained for this, I treat animals. If I try and fail, your son dies. If I do nothing, he dies anyway, do you understand? Breath looked at his unconscious child, then at Amy. You will try? I will try everything I can. Then do it. Please. Amy took a deep breath and began working. She pulled out hemostatic agents she used for marine animals, calculating dosages based on body mass. She carefully injected them near the worst bleeding points. She used surgical glue designed for reptilian skin to begin sealing the torn respiratory membranes. Working with tiny, precise movements, the door opened again. Amy did not look up. If you are not here to help, get out. Step away from that patient immediately. The voice was cold and authoritative. Amy glanced up briefly and saw another Quillen, taller than Breath, wearing what looked like medical robes. This would be Dr. Orthan. No, Amy said simply and returned to her work. You are not qualified to treat a Quillen, Orthan said, moving closer. You are committing medical malpractice. That child has no chance of survival. He has no chance if everyone gives up, Amy said. She finished sealing one membrane and moved to the next. Her hands did not shake. You can help me or leave. Choose quickly. Orthan stared at her. Breath moved between the Quillen doctor and the table, all 4 arms spread wide. She stays. She tries. You gave up. For a long moment nobody moved. Then Orthan made a clicking sound that might have been disapproval. But he did not try to stop Amy. He stood there watching, as she worked to save a life everyone else had already mourned. The child's breathing stabilized slightly. One small victory in what would be a very long night. Amy worked under the bright examination lights while her hands moved with practiced precision. She had spent years treating injured animals, from tiny birds with broken wings to aggressive predators with infected wounds. Every patient taught her something. Every species had its own puzzle to solve. The young Quillen on her table was the most important puzzle she had ever faced. Dr. Orthan remained near the door, his posture rigid with disapproval. Breath stayed close to his son, one hand hovering near the child's face without touching. The respiratory membranes on the young Quillen's neck fluttered weakly under the modified oxygen mask. Amy had sealed the worst tears, but the tissue was badly damaged. She needed to reduce inflammation and promote healing. Her datapad displayed information about Quillen biochemistry. Their bodies used hemocyanin instead of hemoglobin, which gave their blood that distinctive blue color. The protein structure was remarkably similar to what she had seen in earth octopi and horseshoe crabs. She pulled up her veterinary references, searching for treatments she had used on marine animals with similar blood chemistry. You are wasting time, Orthan said. Even if you stabilize the bleeding, the internal damage is too severe. The probability of recovery is statistically insignificant. Amy did not look up from her work. Statistics tell you what usually happens. They do not tell you what will happen right now with this specific patient. She selected a bottle from her medicine cabinet and calculated a dosage. How much do you weigh? She asked Breath. Why does that matter? Because I need to know if your son's body mass is proportional to an adult, or if juveniles are smaller relative to adults. It affects drug dosages. Breath gave her his weight and his son's weight. Amy did quick calculations and injected an anti-inflammatory compound she normally used for injured seals. The child's breathing smoothed out slightly. What did you just give him? Harlan demanded, stepping closer. A corticosteroid derivative. It reduces inflammation and damaged respiratory tissue. I have used it successfully on earth marine mammals with similar biochemistry. Similar is not identical. You are experimenting on a dying child. Amy finally looked at the Quillen doctor directly. Her voice stayed calm but firm. You declared him dying and walked away. I am trying to prove you wrong. If you have better ideas, share them. If not, let me work. Orthan's body language showed offense, but he said nothing more. Amy returned her attention to Pip as she had heard Breath call his son. The child's 3 hearts were visible on her scanner, arranged in a triangle pattern in his chest. The top heart was beating irregularly. The other 2 worked overtime to compensate. She needed to stabilize the cardiac rhythm before the strain damaged all 3 organs. She pulled up more references, Marine animal cardiology, cephalopod cardiac structures. There were drugs that could help, but the dosages would be guesswork. Too little and they would be useless. Too much and she could stop all 3 hearts permanently. I need more information, Amy said to Orthan. What is a normal heart rate for a juvenile Quillen? Orthan hesitated, then answered. Between 60 and 70 beats per minute for all 3 hearts in synchronized rhythm. Amy checked her scanner. The top heart was fluctuating between 40 and 90 beats per minute. The other 2 held steady at 75, working harder to maintain blood pressure. She prepared a cardiac stabilizer, a drug she had used on dogs with arrhythmia. She modified the dosage down, accounting for the different biochemistry. Her hand paused over the injection site. This could kill him, or it could save him. There was no way to know for certain. She injected the drug near the erratic heart and watched her scanner intently. For 10 seconds, nothing changed. Then the heart rate began to slow, smoothing into a more regular pattern. 65 beats per minute, 62, 68, still irregular but less wild. The other 2 hearts relaxed slightly, their rate dropping to a healthier 70 beats per minute. Breath made a sound like a sob. Is he improving? His condition is stabilizing, Amy said carefully. That is not the same as improving, but it is better than getting worse. She began setting up monitoring equipment. He needs constant observation. If anything changes, I need to know immediately. I will not leave him, Breath said. Good. I will be right here too. Amy grabbed a stool and positioned it where she could see all the monitors. She pulled her datapad close and continued researching Quillen physiology. There was so much she did not know. Every decision was educated, guesswork built on cross-species similarities and years of treating animals that could not tell her where it hurt. The clinic door opened and a human woman entered carrying a large bag. Roger, the station engineer Amy sometimes hired for equipment repairs, followed behind her with an armload of tools and supplies. We heard what was happening, the woman said. She was Helen Okoye, the station's deputy administrator. Half the station is talking about the human vet treating a Quillen child. What do you need? Amy felt a wave of gratitude. Monitoring equipment. IV supplies if you can find any compatible with copper-based blood. And coffee. Lots of coffee, Helen nodded. Roger can fabricate what you need. I will handle the station officials who are going to have questions about this. She glanced at Orthan. Is there going to be trouble? The Quillen doctor looked at Pip's slightly more stable readings on the monitors. Something shifted in his expression. I am observing, he said quietly. That is all. Roger started unpacking his tools. Tell me what equipment specs you need. I can adapt standard monitors for different biochemistry readings. As Amy described what she needed, word continued to spread through the station. More humans arrived at the clinic entrance bringing food, blankets, and supplies. They did not intrude, but their presence was clear. One of their own was fighting to save a life, and they would support her however they could. Amy worked through the evening cycle, adjusting treatments, monitoring vital signs, and learning everything she could about her patient. Pip remained unconscious but stable. His breathing was still compromised but adequate. His heart's maintained rhythm. The bleeding had stopped, it was not a cure. But he was alive. For now, that was enough. The night cycle on Crossroads Station meant dimmed lights and reduced traffic through the corridors. But Amy's clinic remained bright and busy. She had pushed 2 chairs together near Pip's monitoring station and tried to rest for a few minutes at a time. Real sleep was impossible. Every alarm, every change in the readings brought her instantly alert. Breath sat on the floor beside the examination table, his 4 arms wrapped around his legs. He had been silent for hours, just watching his son breathe. Amy had learned that Quillen culture valued logic and efficiency above emotional attachment. Parents cared for their children, but open displays of affection were considered primitive, a waste of energy better spent on practical matters. Breath's devotion to Pip was unusual for his species. It made him an outsider among his own people. Tell me about him, Amy said quietly during one of the calm periods. What does he like to do? Breath looked up, surprised by the question. He collects crystals from different planets. Worthless stones, most of them, but he catalogs them, studies their molecular structure. He wants to be a geologist. His voice softened. He spends hours arranging them by color and density. It serves no practical purpose, but it makes him happy. Amy smiled. Sounds like a good kid. He is gentle. Too gentle for our world. Other young Quillans mock him for caring about rocks instead of trade profits. Breath's skin color shifted slightly darker, a sign of distress. I brought him to this station to show him that the galaxy is larger than our cultural rules. That being different is acceptable. You are a good father, Amy said. Breath made a clicking sound. Our medical professionals would disagree. They say I'm emotionally compromised, that I should accept statistical reality and move forward. Reality can be changed, Amy said. That is what we are doing here. The monitor alarm chirped. Amy was on her feet immediately, checking the readings. One of Pip's hearts was showing irregularity again. The top heart, the same one that had been unstable before. She grabbed her medical scanner and examined the organ more closely. There was fluid building up around it, putting pressure on the cardiac tissue. What is wrong? Breath stood, his voice tight with fear. Fluid accumulation, Amy said, her mind racing. She had seen this in injured animals before. Trauma caused inflammation. Inflammation caused fluid buildup, and fluid pressure interfered with organ function. She needed to drain it. But inserting a needle into the tissue around an alien heart was incredibly dangerous. One wrong move and she could cause catastrophic damage. She pulled up anatomical diagrams on her datapad, studying the exact position of the heart and surrounding structures. Quillan anatomy showed a tough membrane around the cardiac cluster, similar to a pericardium. The fluid was trapped between that membrane and the heart tissue. She would need to puncture the membrane carefully, drain the fluid, and hope she did not hit anything vital. Her hands were steady as she prepared the equipment. A long, thin needle, a drainage tube. Sterile technique. She had done similar procedures on dogs and cats with pericardial effusion. The principle was the same. The stakes were infinitely higher. What are you doing? Orthan spoke from his position near the wall. He had stayed throughout the night, observing in silence. Pericardial drainage, Amy said. The fluid pressure is affecting heart function. That procedure has a high risk of cardiac puncture in Quillans. Even experienced xenosurgeons avoid it when possible. Do you have a better option? Orthan said nothing. Amy positioned the needle carefully, using her scanner to guide placement. She felt the resistance as the needle tip touched the membrane. Then the slight give as it punctured through. Phosphorescent blue fluid began draining into the tube. She watched the monitor closely. The heart rate steadied. The rhythm improved. Hold pressure here, she told Breath, guiding one of his hands to the drainage site. Gentle but firm. I need to check the other hearts. She examined all 3 cardiac organs. The drainage had helped. The top heart was beating more regularly now. The other 2 showed reduced strain. But Pip was not out of danger. He had survived the night, but morning would bring new challenges. Roger had finished setting up the adapted monitoring equipment. The displays showed detailed readings of Quillan biochemistry, adjusted to give Amy information she could interpret. Helen had left earlier to file reports with station administration, promising to run interference if officials tried to shut down the operation. As the station's day cycle approached, the clinic door opened again. A group of Quillans entered, their skin colors showing various shades that Amy was learning to recognize as emotions. The leader was tall and wore expensive robes that marked him as someone important. I am Merson, the Quillan said. I serve on the station council. I have been informed that an uncertified human is practicing medicine on a Quillan juvenile without proper authorization. Amy stood up slowly, putting herself between Merson and her patient. I am providing emergency medical care to a patient who was denied treatment by his own species medical facility. You are experimenting on a dying child, Merson said coldly. Dr. Orthan made the correct decision to allocate resources elsewhere. You are giving this family false hope and violating multiple medical protocols. The child is alive, Amy said. That is not false hope. That is fact. Merson looked at Orthan. You should have stopped this. Orthan stepped forward. His skin color showed conflict, patterns shifting across his body. I have been observing her methods. They are unorthodox, dangerous, built on cross-species medical knowledge rather than proper Quillan training. He paused. But the child is alive. She has achieved stabilization that I did not believe possible. Stabilization is not recovery, Merson said. The statistical probability remains that this juvenile will die, and when he does, this human will have committed negligent homicide. And if he lives? Breath asked, his voice shaking with anger. If she succeeds where you refuse to try? What then? Merson's skin color darkened. If he lives, we will discuss the implications of humans providing medical care without proper xenobiological certification. This sets a dangerous precedent. He looked directly at Amy. Save him or lose him, you will face formal review of your actions. Amy met his gaze steadily. I will worry about that after he recovers. After Merson left, the clinic fell quiet again. Amy returned to Pip's side and continued her vigil. The young Quillen's breathing was steadier now. His heart's beat in closer synchronization. Small improvements, each one precious. The night had been long. The battle was far from over. But Pip had survived when everyone except Amy had given up on him. That counted for something. 3 days passed in a blur of medications, monitoring, and constant adjustments. Amy barely left the clinic except to shower in the small bathroom attached to her office. She ate when Helen brought food, slept in short bursts when Pip's condition remained stable, and spent every waking moment learning more about Quillen physiology. The young patient had not regained consciousness, but his body was healing. The respiratory membranes showed new tissue growth where Amy had sealed the tears. His heart's maintained steady rhythm without medication now. The internal bleeding had stopped completely. Every scan showed improvement that defied the original prognosis. Amy discovered something interesting during her research. Young Quillens healed faster than adults, their cells regenerating at remarkable rates. But Quillen medical practice rarely treated severe juvenile injuries because their cultural emphasis on statistical efficiency meant resources went to patients with higher survival probability. The result was that their doctors had little experience with just how resilient their own children could be. His body is doing most of the work, Amy explained to Breathe during one of her status updates. I am just giving it the support it needs to heal itself. Breathe looked at his son with wonder. Orthan said he would die within hours. It has been 3 days. Orthan made a prediction based on incomplete data, Amy said. He assumed juvenile physiology matched adult models. It does not. Dr. Orthan had become a constant presence in the clinic. He no longer objected to Amy's treatments. Instead, he asked questions. Why did she choose that drug over another? How did she calculate dosages for a species she had never treated before? What made her think veterinary techniques would work on sapient beings? Amy answered honestly. All biology follows patterns. Evolution creates similar solutions to similar problems across different species. If I see something that reminds me of Earth animals I have treated, I start there and adjust based on the differences I observe. You use intuition, Orthan said. It was not quite a criticism. I use pattern recognition combined with scientific knowledge, Amy corrected. Every patient teaches me something. I pay attention and adapt. On the 4th day, word of the human veterinarian's success spread beyond the station. Alien civilians began appearing at her clinic with their sick animals and minor medical complaints. A Harvan trader asked if she could look at his offspring's rash, since the station's medical center had a week-long waiting list. A Benari merchant wanted her to examine his pet, which was refusing to eat. Amy treated them all. She researched each species quickly, made conservative decisions, and achieved good results. Her approach was always the same. Find similar Earth biology, adapt treatments carefully, monitor closely, and adjust based on response. Helen visited on the 5th day with a concerned expression. Merson has filed a formal complaint with the station council. He is demanding a tribunal to review your actions. He claims you are practicing medicine without proper certification for sapient beings. Amy had expected this. When? They are scheduling it for next week. You need to prepare a defense. I need to keep my patient alive, Amy said. That is my only priority right now. Helen sighed. Amy, this is serious. They could ban you from treating any non-Earth species. They could fine you or even expel you from the station. This affects every human medical practitioner in the sector. I understand, but Pip needs me right now. I will worry about the tribunal later. On the 6th day, something changed. Amy was checking Pip's vital signs when she noticed his eye membranes flickering. Quillen eyes had translucent protective covers and they were moving. She leaned closer, her heart rate increasing. Pip, she said softly. Can you hear me? The young Quillen's eyes opened slightly. They were large and dark, similar to Earth octopi eyes. They focused on Amy with what might have been confusion. Breathe, Amy called. He is waking up. Breathe moved to the table so fast he nearly knocked over a piece of equipment. Pip, son? Pip's eyes shifted to his father. His mouth moved, forming words in the clicking language Quillens used among themselves. Breath responded in the same language, his voice thick with emotion. Amy checked all the monitors. Heart rates were elevated but stable. Brain activity was increasing. Respiratory function was adequate. She adjusted the oxygen flow and stepped back to give father and son space. Orthan watched the reunion with an expression Amy could not read. After a moment, he approached Amy. "I was wrong," he said quietly. "I declared this child unsavable based on statistical models and standard protocols. You proved that statistics are not destiny. You were working with the information you had," Amy said. "I do not blame you for following your training. But you did not follow training. You ignored it. You experimented." "I adapted," Amy corrected. "There is a difference. I used established medical principles applied to a new context." She looked at Pip, who was now holding one of his father's hands with surprising strength. "Every patient deserves maximum effort. Fear of failure should not prevent us from trying." Orthan was silent for a long moment. "Your approach is inefficient. It requires significant time and resources for uncertain outcomes. It saved a child's life." "Yes," Orthan admitted. "It did." The next day, Helen returned with an official summons. The tribunal would convene in 3 days. Amy was required to appear and defend her actions. Merson would present the case for medical protocol violation. Orthan would testify about proper Quillen medical standards. Amy read the document calmly. "Will Pip be well enough to go home by then?" "Probably," Helen said. "But Amy, you need to take this seriously. Merson is not just concerned about one case. He thinks your success will undermine Quillen medical efficiency. He wants to make an example of you." "Let him try," Amy said. She looked at Pip, who was now sitting up and talking with his father. The young Quillen was weak but conscious, aware, and improving steadily. "I saved a life everyone else gave up on. I will not apologize for that." Breath approached Amy later that evening. "I want to testify at the tribunal. I want to tell them what you did for my son." Amy smiled. "That would help." "Thank you." "No," Breath said firmly. "Thank you. You gave me hope when no one else would. That is worth more than all the efficiency in the galaxy." As Amy prepared for the tribunal, she knew the coming days would be difficult, but she had no regrets. She had done what she believed was right, and Pip was alive because of it. Whatever happened next, that truth remained unchanged. The tribunal chamber was a large circular room in the administrative section of Crossroads Station. Representatives from 7 different species sat in an elevated arc around the central floor where Amy stood. The room was designed to emphasize the authority of the council and the vulnerability of whoever stood before them. Amy kept her posture straight and her expression calm, though her hands were clasped tightly behind her back. Merson stood to her right at a separate podium. The Quillen official had prepared extensively for this hearing. His presentation materials floated on holographic displays, showing medical protocols, certification requirements, and statistical risk analyses. He spoke with the confidence of someone who believed the law was clearly on his side. The human Amy Walsh practiced medicine on a sapient Quillen juvenile without proper xenobiological certification, Merson stated. She administered untested treatments based on veterinary medicine, rather than established Quillen medical protocols. She endangered the patient with experimental procedures that had no scientific foundation for use on our species. The council members listened attentively. Most showed neutral expressions, but Amy noticed that the human representative, a stern woman named Administrator Hayes, looked distinctly uncomfortable with the proceedings. Dr. Orthan declared the patient unsavable based on proper medical assessment. Merson continued. He made the difficult but correct decision to allocate resources to patients with higher survival probability. Walsh's interference with this decision undermines the efficiency of medical practice throughout this station. Amy waited for her turn to speak. Helen sat in the gallery behind her, offering silent moral support. Breath sat beside Helen with Pip nestled against him. The young Quillen was still weak but recovering steadily. His presence in the chamber was Amy's strongest argument. "Let me be clear about what is at stake here," Merson said. "If we allow unqualified practitioners to treat species outside their training, we open the door to medical chaos. How many patients will die from incompetent care before we enforce proper standards?" Administrator Hayes raised her hand. "Are you suggesting that Dr. Walsh is incompetent?" "I am suggesting she is unqualified," Merson said. "Competence requires proper training and certification. She has neither for Quillen medicine, Hayes looked at Amy. Dr. Walsh, would you like to respond? Amy stepped forward slightly. She had prepared no fancy presentations or legal arguments. She had only her actions and her reasoning. I am a veterinarian with 15 years of experience treating diverse species. When Breath brought his dying son to my clinic, I had a choice. I could turn him away and let him die, or I could try to save him using every bit of knowledge and skill I possessed. You had no training in Quillen physiology, Merson interrupted. I had training in comparative biology, cross-species medicine, emergency trauma care, and adaptive problem-solving, Amy replied. I researched Quillen biochemistry, identified similarities to Earth species I had successfully treated, and applied proven medical techniques with appropriate modifications. She pulled up her own display, showing detailed notes from Pip's treatment. Every decision I made was documented. Every medication was calculated based on body mass and biochemical compatibility. Every procedure was performed with sterile technique and careful monitoring. I did not experiment recklessly. I adapted methodically. One of the council members, an insectoid being from a species Amy did not recognize, spoke up. But you had no certainty your treatments would work. No doctor has certainty, Amy said. We work with probabilities and best practices. Dr. Orthan calculated a 12% survival probability and decided that was too low to justify treatment. I looked at the same patient and decided 12% was better than 0. The standard protocol is based on resource efficiency, Merson said. We cannot save every patient. Difficult choices must be made. I agree, Amy said, but giving up without trying is not a difficult choice. It is an easy one. The difficult choice is to try when the odds are poor, to adapt when the textbook has no answers, to keep fighting when logic says to quit. Roger stood up from the gallery. May I speak? Administrator Hayes nodded. You may approach. Roger came forward and described the equipment he had fabricated for Amy, the monitoring systems adapted to track Quillen biochemistry, and the careful safety protocols she had followed. Dr. Walsh did not work recklessly. She worked innovatively within safe parameters. Helen testified next, presenting records that showed Amy had attempted to contact 3 qualified xenobiologists for consultation. All 3 had refused involvement in a case they considered hopeless. She tried to follow proper channels, Helen explained. When those channels failed, she made a choice between abandoning a dying child or using her extensive medical knowledge to try saving him. Then Dr. Orthan was called to testify. Merson expected support from his fellow Quillen, but Orthan surprised everyone. I was wrong, Orthan stated simply. I followed statistical models and established protocols. I made a logical decision based on standard medical practice, and I would have allowed a child to die needlessly. He looked at Amy. Dr. Walsh showed me that medicine is more than following guidelines. It requires adaptability, creativity, and the willingness to try when others give up. Merson's skin color showed agitation. You are allowing emotion to cloud your judgment. Perhaps, Orthan agreed. Or perhaps I am learning that emotion serves a purpose in medicine. Compassion drives us to find solutions that pure logic would miss. Finally, Breath was allowed to speak. He carried Pip to the center of the chamber. The young Quillen was shy in front of the crowd, hiding against his father's torso. This is my son, Breath said. His voice was steady but filled with feeling. He was dying. Your medical system said his life was not worth saving, that the resources required exceeded the probable benefit, that I should accept his death as inevitable. He held Pip closer. Dr. Walsh said no. She looked at my son and saw not a statistic but a person worth fighting for. She gave me something more valuable than efficiency. She gave me hope. The chamber was silent for a long moment. Then Pip spoke, his voice small but clear through a translator device. Dr. Amy saved me. She was nice. She told me not to be scared. Administrator Hayes looked at her fellow council members. I believe we have heard enough testimony. We will deliberate and render a decision. Amy waited while the council members conferred in low voices. She had said everything she could say. She had done everything she could do. The rest was out of her hands. After 20 minutes, Administrator Hayes spoke. We have reached our decision. Administrator Hayes looked directly at Amy as she prepared to announce the council's decision. The chamber remained silent except for the quiet hum of the station's environmental systems. Amy kept her breathing steady and her expression neutral. Though her heart raced, Dr. Amy Walsh, Hayes began. You have been charged with practicing medicine without proper xenobiological certification, specifically in treating a Quillen juvenile with techniques not approved for use on sapient beings." She paused. However, this council recognizes several mitigating factors. Amy saw Merson's skin color shift toward darker tones of displeasure. Hayes continued. "First, you acted in a genuine emergency situation, where the patient had been denied treatment by qualified physicians. Second, you documented your methods thoroughly and worked within safety parameters. Third, and most importantly, you succeeded. Your patient survived and is recovering well." One of the other council members, a reptilian being named Counselor Vresh, spoke next. "We find that Dr. Walsh did violate established protocols by treating a species outside her certified expertise. However, we also find that rigid adherence to these protocols would have resulted in the unnecessary death of a patient who could be saved." Administrator Hayes nodded. "Therefore, the council's ruling is as follows. Dr. Walsh will be permitted to continue her practice on Crossroads Station. However, she must maintain detailed records of all cross-species treatments and consult with qualified xenobiologists when possible. Her success with this case is recognized as a legitimate emergency intervention, not reckless experimentation." Amy felt tension drain from her shoulders. It was not a complete vindication, but it was enough to continue her work. "Furthermore," Hayes added, "this case has revealed gaps in our station's medical emergency protocols. We are establishing new guidelines for situations where patients are denied treatment by their species' medical facilities. Medical practitioners of any species will be permitted to provide emergency care outside their primary expertise, provided they document their methods and demonstrate reasonable competence." Merson stood abruptly. "This is a mistake. You are prioritizing individual cases over systematic efficiency." Counselor Vresh regarded him calmly. "We are prioritizing life. Is that not the foundation of all medical practice?" The Quillen official had no response to that. He gathered his materials and left the chamber, his displeasure evident in his rapid movements. After the tribunal concluded, a small crowd gathered around Amy. Other humans congratulated her. Several aliens asked questions about her treatment methods. A young Harvan doctor named Liss approached shyly and asked if Amy would be willing to teach some of her adaptive techniques. But the most surprising visitor came the next day. Dr. Orthan appeared at Amy's clinic in the morning, carrying a data pad and wearing what might have been a hopeful expression. "I have a proposal," he said without preamble. "I want to learn from you. Your intuitive approach to medicine. Your ability to adapt knowledge across species boundaries. These are valuable skills that our medical training does not emphasize." Amy set down the bandages she had been organizing. "You want me to teach you?" "I want us to teach each other," Orthan corrected. "I can provide you with proper training in Quillen physiology and other species' medical needs. You can show me how to think creatively when standard protocols fail." He activated his datapad, showing a detailed proposal. "Together we could develop a cross-species emergency medicine program, something that combines systematic knowledge with adaptive problem-solving." Amy looked at the proposal, her mind already racing with possibilities. That could help a lot of patients. "It could change how medicine is practiced throughout this sector," Orthan said. His skin color showed enthusiasm, patterns of light and dark flowing across his surface. "You have proven that rigid protocols are not always optimal. But pure improvisation without foundational knowledge is also dangerous. We need both approaches working together." Over the following weeks, Amy and Orthan began their collaboration. They taught classes to mixed groups of medical practitioners from various species. Orthan explained the systematic approach to xenobiology, the importance of understanding biochemical pathways and physiological systems. Amy demonstrated pattern recognition across species, how to identify similar structures and adapt treatments safely. Their most enthusiastic student was Liss, the young Harvan doctor. Others joined as word spread about the program. Even some of the more conservative physicians admitted that Amy's success with Pip had revealed blind spots in their training. Pip himself became a regular visitor to the clinic. He was fully recovered now, his energy restored and his crystal collection growing from specimens he found around the station. He helped Amy with animal patients, his gentle nature making him excellent at calming nervous creatures. Breath often joked that his son would become a veterinarian instead of a geologist. The most unexpected development came 2 months after the tribunal. Merson appeared at the clinic entrance one evening, after the regular hours had ended. Amy was finishing paperwork when she noticed him standing uncertainly in the doorway. "Dr. Walsh," he said. His voice lacked the hostile edge it had carried during the hearing. "May I speak with you privately?" Amy gestured to a chair. "Of course." Merson sat, his forearms folded in what Amy had learned was a posture of vulnerability. "I owe you an explanation and an apology." He was quiet for a moment, gathering his thoughts. 3 years ago, my daughter was injured in an industrial accident. The injuries were severe. The survival probability was calculated at 15%. I was told that treatment would be inefficient, that resources should be allocated elsewhere. Amy listened without interrupting. "I accepted that decision," Merson continued. "I believed in the system. I told myself that logic and efficiency were more important than individual attachment. My daughter died." His skin color darkened with grief. "When I heard about your treatment of Pip, I was angry. You succeeded where our system failed. You gave Breathe the hope that I was denied. I wanted to punish you for proving that my daughter might have been saved if only someone had tried. I am sorry for your loss," Amy said quietly. "I was wrong to oppose you," Merson said. "Wrong to value efficiency over life. Wrong to accept that some patients are not worth saving." He met her eyes. "Would you be willing to teach Quillen doctors your methods? Not just here on this station, but in our home medical facilities, so that other families might have the hope I was denied?" Amy felt the weight of his request. This was bigger than one patient or one station. This was about changing how an entire species approached medicine. "I would be honored," she said. "But it will take time and cooperation from your medical establishment." "I will make it happen," Merson promised. "I have influence on our homeworld. I will use it to open doors." 6 months after treating Pip, Amy found herself teaching in facilities across 3 different worlds. Her small veterinary clinic had become the starting point for a revolution in cross-species medicine. The program she developed with Orthan was being adopted by medical schools throughout the sector. But Amy never forgot her roots. She still treated injured animals in her clinic. She still took on the difficult cases that others considered hopeless. And every time she worked with a new patient, she remembered the lesson that Pip had taught her. Statistics predict what usually happens, but individual patients can always surprise you. Humanity's gift to the galaxy was not superior technology or greater intelligence. It was the stubborn refusal to accept that anything was truly hopeless, combined with the creativity to find solutions where others saw only dead ends. Amy embodied that gift every day in her work. The young Quillen who had been hours from death was now healthy, happy, and helping others. His survival had changed medical practice across multiple worlds, all because one human veterinarian looked at a dying alien child and decided that 12% odds were worth fighting for. Sometimes the most important decision was simply deciding to try.